So Heidi's going to be talking to us all about how skin health, about how microneedling relates to skin health. So Heidi, you have a presentation planned, and hopefully everyone is either in or is making their way in now. So if you, everyone watching, if you have any questions for Heidi as she's going through, if you want to pop them in the chat box, we have someone there moderating them. Both Heidi and I are going to switch our cameras off as she goes through, but then we'll both jump back on at the end, and I will pass those questions on to Heidi for you. So Heidi, welcome. If you're ready, then I think we can probably get started.
Yeah, great, super.
Cool. All right.
Hi everybody. I just wanted to talk to you a little bit about why microneedling is such an integral part of my treatment portfolio, and how I came to the decision that SkinPen Precision was the safest decision for a safe incision. Okay, so a little bit about the history of microneedling. Microneedling has been around for a long time in many different guises. It was first recorded to be used in 1905, and that was developed by a German dermatologist, and he experimented with various different sized dental burrs mounted on a motor, driven by a flexible cord, and of course things evolved, but he was already treating scars, birthmarks and hyperpigmentation. And then fast track on to 1995, which is much more of our era, and Dr. Des Ferdinandez in Philadelphia started to really reinvent microneedling and commercialize it and make it available to everybody else, and using it to treat wrinkles and scars. And around the same time, he started to develop a stamp device used for inducing collagen production. The research was developed, and there have been many different types of microneedling devices: rollers, stamps, pens, freehand, and much more research to endorse these devices for treating many different skin conditions other than just scars. So they all sort of capitalize on the body's innate ability to heal from a wound, and produces or induces collagen production, elastin production, eliminating wrinkles and fine lines, smoothing out the skin, and treated pigmented areas and brown spots. So a wide variety of applications from microneedling, and a wide variety of different microneedling devices. So if we think about what is microneedling, so microneedling is just the process of making tens of thousands of micro injuries into the skin. So it's just the process of making those injuries to stimulate the body's innate ability to wound heal, so triggering this cascade effect of the wound healing response, which would lead to a remodeling of collagen fibers. So collagen induction therapy triggers the wound healing response. So sensory nerve endings initially receiving the information there's been an injury and sending the message to the brain, stimulating the cell membranes, and the mast cells simulated that all lead to the release of neurotransmitters, a complex signaling process made up of growth factors and cytokines, instigating the proliferation of platelets, fibroblasts, epithelial and endothelial cells that will immediately instigate the natural healing response, leading to the repair and the regeneration of new healthy tissue. So we have to make these tiny, precise injuries to trigger that response. So the key there is that they are tiny, precise injuries. So always remaining focused that we want to do the minimum amount of damage to get maximum effect, and the risk, of course, of over damaging the skin and your body believing it needs to make scar tissue to repair and recover. So this wound healing response will not only instigate epidermal repair, but it will also instigate dermal regeneration. So there's long-term effects as well as the short-term effects. So the production of cutaneous collagen and the fortification of epidermal tissue and increased integrity and density of the dermal matrix. So these long-term effects start to appear more in the phase 3, the final phase of the wound healing response, where this immature collagen will start to maturate and mature and reorganize itself into more mature type 1 collagen, giving our long-lasting response. So these sort of effects we start to notice typically a month after the treatment, but the benefits can carry on for over a year post-treatment. So studies have been conducted to prove the results of microneedling, which we're now able to do with taking biopsies of the skin, taking scans of the skin. So many different modalities have been used to measure the results and prove the efficacy of microneedling. We're able to prove that as proliferation and remodeling takes place, and support in the dermal epidermal junction, and the results in the results are gradual and not reversible. So the results actually are increasing over time as the continuation of treatments will support each other. So we've been able to prove the dermal thickness of the skin will increase by 0.5 mil, so quite an considerable increase in the thickness. This is after 5 months, and so this is showing 400% increase in the thickness of the dermis after 6 months. So the levels and the regeneration and remodeling will be linked to the genetics, the lifestyle, the age, and the health. So we have both intrinsic and extrinsic factors to consider. And so it's very important that the treatment is combined with support in a good consultation for your patients. So in my consultations, I do explore a little bit my patient's lifestyle choices and what she can do to support the treatment. It is on its own a fully organic treatment, and we are relying on the glycoproteins, stem cells, growth factors within your patient's own body to deliver these nutrients and to benefit the skin. And so if at all you're feeling that your patient could possibly clean up a lifestyle with induced hydration, a good range of skincare products to support the treatment, and then also consider her diet as well, so and possibly dietary supplements if she's not already eating a healthy, well-balanced diet. All these things will affect her body's ability to respond to the injuries that we create, and in response to those injuries, how it will lay down this new proliferation tissue to mature over time. So if we want to take a further or deeper look into these 3 phases of wound healing, we have the first phase, which is the inflammation phase, which also has the hemostasis and coagulation. So in this first phase, our sensory nerve endings will send these signals to our brain, which will respond initially with an increased flow of blood. And this blood will create erythema and edema in the skin, which your patients will witness during the course of the treatment, sometimes with some tightness and tenderness, and sometimes in inflammation you can get momentarily loss of sensation in the skin. I find this doesn't happen at all in my microneedling, because remember, we're doing very acute injuries, so there's no fibrosis, there's no scarring induced. It's all about precise minimal injury. Okay, so the bleeding, your body will then control the bleeding, and there'll be a contraction of the capillaries, and the blood will deliver the platelets. It'll be blood that's particularly rich in white blood cells, and they will be responsible for the coagulation to form to stop the body from bleeding out. The delivery in these rich blood of the neutrophils, macrophages, and cytokines, which are very important, responsible for the secretion of the antibacterial chemicals to make sure that the wounds are safe. It'll remove any foreign particles or necrotic skin tissue that needs to be broken down. So these macrophages will go phagocytic and engulf any dead skin tissue. And then also they will be responsible for initiating the angiogenesis and the granulation process. So remember, these 3 phases of wound healing overlap in time. You don't finish phase 1 and enter into phase 2. The 3 phases will overlap. So before you end inflammation, you will already have started forming some new granulation tissue. So tissue proliferation will already have started within 24 hours of your injury. So this second phase that we call tissue proliferation will have our fibroblasts proliferating. So not only will the fibroblasts move into the wound site, but they will also proliferate and start to reproduce. Our fibroblasts will be responsible for releasing growth factors, messaging signals, glycoproteins, and collagens. So these epidermal cells will migrate to the wound area, and we'll have some epithelialization with the formation of some new immature granulation tissue. And as that wound starts to contract, the skin will continue to feel tighter. The erythema should have calmed down, but the skin will still feel tight. With angiogenesis, there will be some new capillary formation and repairing of capillaries, and the capillaries will be absolutely key for delivering all the micronutrients to the area that needs them. So this tightness, as the keratinocyte cells migrate to tighten up and close the wounds, will start to ease towards the end of the proliferation phase. So proliferation can continue from day 1, typically up to a week. And that immature type 3 collagen will then be laid down and will be sort of developed and reorganized to form this type 1 collagen, which will be much more robust and stronger. There'll be much more increased tensile strength. Sorry, I've not been a bit slow moving the slides on. So here we have this tissue proliferation phase, as we talked about the fibroblasts being very active. And continuing to proliferate, and that will lead us into this immature temporary type 3 collagen reforming itself to type 1 collagen, which will be much stronger and more robust. So this phase, the tissue remodeling phase, or the final phase, can typically carry on for over 300 days. So a patient can benefit from a single treatment for over 300 days post-treatment date. So benefits for the of this treatment will be not just on the skin tightening, or not just on improving acne scarring or trauma scarring, but also to improve the pigmentation in the skin, or any discolorations in the skin, as it's quite likely to be an exfoliation after the treatment. It'll support the skin integrity, and we will just get this all over radiance and glow post the treatment, as well as obviously plumping and tightening the skin, as you would expect with new collagen formation. Like I said earlier, these 3 phases of wound healing are very much affected by each individual patient's ability to recover from the wound, and that can be quite unique. Various factors can affect that, such as a patient's age, sex, their diet, their lifestyle choices. So lots of things will affect their ability to wound heal. And they need discussion in the consultation beforehand so you can prepare your patients. So when we look at these 3 phases of wound healing, and we have these micro injuries there, releasing the platelets in the blood, in the rich blood that's delivered at the time of the treatment, key for carrying all the nutrients. And then when we look at the second slide, this is one of our scans to prove the increase in dermal thickness of 0.5 mil over, this is 5 months after treatments. And then in our final picture here, we're looking at the tissue and we're proving up to 400% more collagen. So just when you see the slides, you can already see the increase in the capillary network. So with that much stronger capillary network, we're going to get much more nutrients delivered to the surface of the skin, which will better feed the skin for the future. So much more collagen, much healthier looking skin. Okay, so having talked about how microneedling works by inducing these injuries so that your body creates more of its own natural collagen. So the results you can expect are very natural looking. So your patients are going to look healthy, radiant, fresh, youthful, which I think is a general trend with anti-aging now, is to maintain your unique features but look like you on a good day. And that's really what this treatment does for you. So now that I have sort of talked about the benefits of having microneedling, some of the other things I've not really mentioned is that compared to other modalities, we have very little adverse reactions, very little contraindications. It's suitable for all skin types, and it can be carried out through all year round through on tan skin. So for me, one of the primary reasons I love doing the treatments is the radiance and glow is addictive, but I sleep really well at night after I've done a microneedling treatment, because I know I've made a big difference to my patient's skin, but I know I'm not going to get lots of concerned phone calls because there's just so little risk of adverse reactions compared to other treatments that get the same level of results. So that for me is why I really think microneedling plays an absolutely pivotal role in the range of treatments I offer my patients. So once I decided I wanted a microneedling device, there's many different factors you must consider, as not all microneedling devices are equal. And when we make these decisions in our clinics, I think the most important thing that you must always consider is the safety to the patient. So when we start thinking about safety, let's have a little look at what SkinPen Precision has done for the safety of patients going forwards. So SkinPen Precision recognised a hole in the market for a truly sterile device. So all the predecessors couldn't claim they were truly sterile, and there were starting to be cases of cross-contamination from patient to patient, where even though devices may have a sterile needle head, they were being put onto a dirty device because it's impossible to truly sterilize the motor element of the pen. So blood was passing through these needle heads into the pen itself, harbouring there in the little cracks and crevices within the pen. And then when a new clean needle's put on, they were cross-contaminating from patient to patient. So this really did concern me. So I started to look for a device that would address this problem. So let's just have a little look what SkinPen does to address this problem. So SkinPen Precision is comprised of a reusable motor unit designed to attach to a sterile disposable cartridge that houses 14 microneedles, these 32 gauge stainless steel needles, on a reciprocating head, which when activated and placed properly against the skin can create hundreds to thousands of micro punches in the skin. SkinPen Precision's patent pending cartridge design inhibits the entrance of fluids, Ingress Protection of up to 100% ultrasonically handheld pen device, preventing potential cross-contamination of the motor unit between use. So what this really means is that the pen itself is fully sealed, so there are no cracks that can hold bacteria or bloodborne bacteria. And then also what they have done is they have taken the part of the device that changes the depth of the pen. So the where you turn the needle depth up or down, they've made that part of the disposable element. So most pens have this part in the device, in the handheld device, the motor part, whereas SkinPen Precision have made this part of the disposable unit. So not only do you get a disposable needle head, attached to that is the changeable device. So the whole thing goes in the bin every time for every single patient. So this way we can absolutely guarantee there's no risk of cross-contamination. Further measures that have been taken to prevent cross-contamination are also that they have switched the male and female components of the needle head. So I'm going to talk a little bit about that next. But before I move on, I must mention they also have a biosheath. So this is really like a glove that protects the motor itself from your glove and from your hands, which are touching your patient's face. And so to have a full protection for the pen itself, because we know we can't dip these pens in barbicide, or, there's no true way to put your pen in an encave to sterilize it. So we must put a protective sheet over the pen. So these three main attacks to avoid cross-contamination that have been addressed is, first, the cartridge is double lined. So that means the disposable element is double lined, providing ingress protection so that no liquids can pass from the disposable element into the motor element because it's double lined. Secondly, the motor element itself is ultrasonically sealed. So if somehow something was to touch the outside of that pen, it can't penetrate into the body of the pen itself. And then thirdly, by having the sheath as well to protect the exterior of the pen. So the SkinPen Precision was the first pen on the market that had FDA clearance and a CE mark. So it currently has the highest standards really across all nations. So it has its ISO certified for quality and assurance, its BSI kite mark, which is saying that it's safe, reliable and conforms to all relevant safety standards. It was the first completely sealed device on the market. And because it's ultrasonically sealed base, there is zero risk of cross-contamination, making it the treatment or the device of choice for work within surgery and in any sort of high-risk situation, because it is so well sealed. So no bodily fluids can enter into the device. The disposable needle tips act as a disposable pen, because not only does it have the needle, it also has the device attached, and the whole thing goes in the bin every time. A disposable sheath to protect the body of the pen, and again a fresh one is included in the kit, so you get a fresh one every single time. And the 14 sterile precision needles. A little bit more about needle quality, having worked with lots of different microneedling devices. Not, as you know, as surgeons, not all needles are equal. So what I find with these needles is they stay particularly sharp for a long time. They are in fact guaranteed for 90 minutes of continual use, making it possible to treat a second area within one treatment appointment. which means it's a better profit margin for yourself as a clinic, but also economically viable for your patient too. But also by having such sharp needles, you find you get no rips, tears or drags, which means a much quicker recovery, and the body's more able to focus its attention on making the right type of collagen with no concerns that it needs to make any scar tissue because of excessive trauma caused to the surface of the skin by hooked needles or blunt needles. And then finally, the device is wireless. Not only is the device wireless, but the motor that they have is so reliable and consistent. So I've never had the problem of my device failing during a course of the treatment, because if it's fully charged up every night, it works all day the next day without having to be recharged. So it's a really reliable motor, and it gets rid of the problem of having a wire that dangles down over your patient's body or over your body, or potentially from body to body, risking contamination again. Okay, so a little more about the needles, so demonstrating the ability for the needles to perform consistently across extreme thicknesses. The needle performance can meet the customer needs. So as part of its testing, the needles were tested on all types of skin, on all areas of the body. So even on the thickest skin, we were able to get consistency and reliability with the needles puncturing the skin and creating the right type of injury. And further back to our fluid Ingress Protection, these cartridge heads have been sort of double sealed to prevent the risk of fluids passing from one element of the pen to the other element of the pen. We call this Ingress Protection. So the cartridge heads are also developed to avoid suction. So we know we need to avoid suction. And then also one of the downsides to suction is you can get dragging or the sort of tramline effect on skin. So through having little holes in the side of the cartridge, we are able to prevent any suction from the cartridge head. The cartridges are also developed with a lockout, which means that once the cartridge has been applied to the pen, it can't be reapplied later because the cartridges are designed for single use, again to prevent cross-contamination and to maintain the efficacy of the treatments, because the needles will be perfectly sharp and sterile every time a patient receives a treatment. So throughout the rigorous testing that the device went under, they were able to prove that the pen consistently performed at exactly the same depth and accuracy every time. So a little bit more about the Ingress Protection. So this is explaining a little bit about the male and female parts in the pen. So in this slide, we can see on the left the SkinPen Precision, and it has the male element of the pen on the body of the mechanical device, opposed to other devices that has the female element of the pen, so the receiver or the hole, you could say, inside the mechanical device, both with the opposite in the cartridge head. Not having a hole in the pen itself, this contributes to being able to make sure that the pen itself can't receive any bloodborne bacteria, unlike the device. So they've switched the male and the female that creates the pumping action in the motor to help prevent the risk of cross-contamination. So again, reiterating these 3 steps that SkinPen Precision takes to guarantee that there is no risk of cross-contamination, and all fluid Ingress Protection is absolutely safe and protected. Okay, so next I'd like to look at some of the results that can be achieved with microneedling. We have a picture here of a lady who's 66. She's had 2 procedures, very typical of a patient that I would see. This is not my slide, but it's very typical of what I'd see, where you can see an improved integrity in the skin, improved support, softening of the lines and wrinkles, as well as clarity through her skin, so improving on the pigmentation in the skin too. So all round, and that's just 2 treatments. Also here we can see some scar treatments. So SkinPen Precision was initially developed to treat acne scarring, and further now we're using it widely for lots of other treatments: stretch marks, scalp treatments for hair, solar lentigines on the back of the hands, décolleté treatments, and fine lines and wrinkles of the face. But primarily its initial clinical trials were all developed on acne scarred skin. So I have a lot of evidence proving great improvement in the skin of acne scarred patients. And again, another patient here with acne scarring, and we can see not just improved post-inflammatory hyperpigmentation, but also the indentations in the skin, and just the general appearance is much smoother, and that is after 5 procedures. So when a patient normally comes to me with acne scarring, I normally prepare them for a course of 6 treatments once a month, and I would look for them to make the final review of the treatment not before a year, because remember we talked about it really does take a year to get the final results for this maturation, for this collagen to lay down and really start to see your long-term effects. So short-term effects are very addictive. Most of my patients adore the short-term benefits, but the real integrity in the skin takes time to develop and really come through. So make sure in your consultations you fully explain the difference between short-term benefits and long-term benefits, so that your patients' expectations are realistic, and that way you'll get satisfied patients every time. Okay, so these are the contact details if you come to the decision that SkinPen Precision is the right decision for your safe incisions. So this is how you can contact SkinPen UK. I hope you've enjoyed my talk about why I think microneedling is great for your clinic. And I've got some questions coming up, so I want to make sure I have time to address those. So I will end my presentation now and go on to Q&A.
That was great. Thanks, Heidi. Yeah, there are loads of questions. So I'm not sure whether this will change for everyone's screen. If I just change, has that changed and got rid of the presentation so you can see it's a bit bigger? Yeah, that was brilliant, really informative. So, okay, let's start with some of these questions. So, someone has asked what length of needles you would use for acne scarring. And obviously I know with SkinPen you can adjust your needle depth. So what would you do for acne scarring?
Okay, so generally when we treat acne scarring, we want to be in the dermis rather than the epidermis, but the depth of different people's dermis really varies. So typically somebody, I'm being very general and vague now, but typically somebody that's suffered with acne scarring has slightly thicker skin, and so I would typically be looking between 1 and 1.5 mil. Because I'm in the dermis, I would be looking for pinprick bleeding rather than no blood. So I always think of epidermis, no blood, dermis, blood. So we want to be as deep as it takes to get pinprick bleeding, which for me is normally around 1 and 1.5 to 1.5 mil.
Great. And someone on that as well, someone else had asked, what would you always want to bring blood to the surface during the treatment? So, I mean, like you just said, I guess it depends, doesn't it, what you're treating?
Exactly, yes. So for acne scar treatment, so if our target is dermal, then yes, we want blood. But for vast majority of treatments, we don't want blood. So all anti-aging treatments, we want to be epidermis, no blood. For pigmentation, we want to be in the basal layer, so right at the bottom of the epidermis, so almost blood, but still no blood. So a lot of treatments are no blood. So initially, when we first started microneedling, it was very bloodthirsty, and everyone thought of the Kim Kardashian vampire facial, but now a lot of what is perceived to be blood is topically applied through PRP treatments rather than actually dripping blood during the course of the treatments.
Yeah. Do you have difficulties with treatment uptake due to downtime? And do you always use a topical anaesthetic to minimise discomfort?
Yeah. Okay. So yes and yes and no. I have. There's very little downtime after this treatment. It's one of the reasons I love the treatment is people can come if they want to come. They can come every 3 weeks. I recommend at 4 weeks, and there is very little downtime. So really, 24 hours typically. You're going to be a little bit red, but a typical patient's normally recovered within 24 hours. So you might be a little bit flaky if your skin is quite dehydrated, but generally you're good to go the next day, so you don't need time off work.
Brilliant.
And your other question was, remind me, sorry.
Oh, no, do you use topical anaesthetic with every patient in every instance?
Yeah, so I don't use topical anaesthetic through the scalp when I'm treating the scalp, and I don't use topical anaesthetic for the back of hands. However, the face and the décolleté I do, and the body for stretch marks and things I would. And the reason is I don't want to compromise the quality of my treatment because my patient's wriggling around. It really doesn't need to be uncomfortable. So I always do use topical anaesthetic for the face, except of course if they have a reaction to it. So if a patient's never had topical anaesthetic, I'd have done a patch test in their consultation. So I do use most of the time topical anaesthetic, yes.
Yeah. Okay. Someone is asking how microneedling compares to Profilo, which is better. So this may or may not be something that you feel like you can answer, but do you have an opinion, perhaps?
Yeah, I have an opinion, but it's not fact-based because I didn't do a clinical trial. So it really is just my opinion. But I would say Profilo is a great treatment. Microneedling is a great treatment. And actually you can have both treatments. But I don't believe Profilo gets the same benefits in the integrity in your skin. It's more of a moisture and it fades. So you have it, you put it there, but it does fade. Whereas that's a very ignorant understanding of Profilo, I guess, to a Profilo expert. Whereas my understanding with microneedling is that I'm giving the whole system a kick of the backside, basically. So I'm reminding you to do the work yourself, and it will be an ongoing result, and you'll see results for much longer than you would with Profilo. And also it addresses a wider range of problems than what Profilo would address.
Great, thank you. So similar in terms of combining the other treatments. Someone's asked, can we combine microneedling with mesotherapy or peeling?
Yeah, definitely. Peeling, I still find questionable. I know lots of clinics that do want to prep the skin with the peel before they do microneedling. My experience is if the patients, if I want to go deeper in the skin, I just turn my pen up another click. So I don't need to thin the skin before I do the microneedling because my needles will penetrate any depth of skin that I want. So I don't believe really in pre-peeling, and I think it slightly oversensitizes the skin. But also, if the skin is dehydrated and needs to shed, then all my patients will shed in the week after microneedling if they need to, but it's not a forced peel. It only happens if your skin feels it needs to peel. So I prefer it over a chemical peel, which is a forced peel, which is thinning the outer layers of your skin. Whether you need to or not, it's a forced peel. So I prefer it from peeling, and but I know a lot of clinics that do combine with peels. Mesotherapy is a marriage made in heaven, in my opinion. I think microneedling works really well with mesotherapy, particularly in patients that need that extra help and support. So mesotherapy being the use of micronutrients that are only pharmaceutical grade. So I must clarify, you can't use any old mesotherapy. It must be the right grade mesotherapy, because we're putting holes in the skin that go quite deep. And so you can't use a topical grade product at the same time as microneedling unless it's a pharmaceutical grade. So that's really important, or else you can get an adverse reaction. But then once you've got the right grade of product, then yes, I think they work really well. And how I would do that is I would apply mesotherapy in areas of need. So from myself, maybe nasolabial folds or crow's feet or whatever. And then I would topically apply further ampules during the microneedling process. So I wouldn't use the mesotherapy topically before microneedling, because it just runs off the surface of the skin. So it's immediately after microneedling, you get a temporary dehydration, and the skin will drink up your mesotherapy then. So that's the time to apply it, is immediately after or during the microneedling.
Great, thank you. What if, so contraindication potentially question, what if your patient is taking meds, blood thinning meds?
Yep. So it really depends on how blood thinning they are. So if they're just having an aspirin, then I would not have a problem with that. If they're on quite a high dose of warfarin, then it's a problem, and no, it's definitely a contraindication. So it depends on what level of blood thinners it is. We're not really, and it also depends on what depth you want your treatment to be. So if it's a relatively epidermal treatment, so you're not going too deep, and they're just on a low level of anticoagulant, then it wouldn't be a problem. But if they are, not anticoagulant, blood thinners, but if they are on a higher dose and you're wanting to do a dermal treatment, then it becomes a greater problem. So it's case by case.
Great, thank you. We have quite a few more questions, but we're going to have to wrap up soon. So I'm just going to do one or two more. So let's ask, if you were treating the scalp, someone's asked what would aftercare be?
Yeah, and I can see one here about what depth. So scalp, I go 0.5 mil, and aftercare, don't wash your hair for 24 hours, and they should be taking nutritional supplements with biotin in, but no other specific. So have a treatment once every 2 to 4 weeks, 0.5 mil, and get the nutritional support to help that on, and maybe a meso ampule with nutrients in during the treatment.
Great. There's quite a few questions here around the sort of the price and more of the details about the SkinPen device itself. So you can always get in touch with SkinPen. We'll flash the contact details up again in a sec. You can get in touch with those questions for SkinPen specifically. And then, because we do have to finish now, what we can do, we will make a note of all these questions, and we can always take this over to Facebook. And Heidi, if you wouldn't mind, you can perhaps answer some of them in the comment section. But thank you so much for all your questions, everyone.
I'm so pleased there are so many questions. We will absolutely get back to every single question.
Yeah, no, we'll make sure all your questions are answered. Thank you, Heidi, for what's obviously been a very engaging and interesting talk.
Enjoyed it.
And thanks for joining us, everyone. And we will make sure that all the other questions get answered, but hopefully some of them have been already. Great. All right. Well, thanks so much, Heidi. And we will see you all throughout the day and the rest of the week, everyone, for more sessions for Virtual Week.
Great. Thank
you. Cheers. Bye.